going to talk about one case, clinical case, but it's all about 4 factors that cause diseases. It's infection, toxins, not proper nutrition, and stress. And we can hear from many people, or we can experience people might have a bad smell from the body or from the mouth, and sometimes it's hard to get rid of. So I'm going to tell you a brief history of one of the patients, and he had a terrific result. So this patient was 27, he is 27 years old, male. He developed bad smell. His wife told me that she could not approach him closer to 3 feet. It was so bad. She said cadaver smell. And to make the story short, I did one treatment for him. I'm not going to talk about this treatment in details because it's sensory information, and if somebody interested, they can call. So this one treatment basically achieved like 90% result, and they came back 6 months later because the smell started coming back. So I did another treatment, and next time he came for following treatment, and his smell was almost gone again. So why I'm telling you this clinical story, the reason all diseases, like I said, infectious. So when I did a treatment, I did universal approach to kill infection, and it did work. So when we eat food, when we drink water, when we breathe air, anything can come out to our body. At this point I'm excluding any bad teeth, cavities in the teeth. It was not the reason. In so many cases, people have a healthy teeth, but they have a bad smell, and also body smell is different issue. But the same etiology. So what happened when we get infectious agents in our body is it goes into small bowel, and here it multiplies, goes to the bloodstream products. They go through the liver first, and if liver doesn't handle it, then we have results what I just described to you. So the idea is to somehow address this infection so we can help people, because the bad smell, and then in 10, 20, 30 years it can be different issues like arthritis and other health problems. As a conclusion, I want to give you a very simple idea what I mean, how I can explain to you better. When you have a car, when you buy the car, you go every, let's say 5,000 miles, you change the filter, you change the oil at least. So the same principle applies to human body. And what the treatment I did is basically was cleaning his blood from any toxins and infection agents. So everybody needs some kind of prophylactic treatments. Even if no clinical signs, no disease, no symptoms, you feel fine. But in case of any, like I mentioned this today, smell from the mouth, from the body, from the feet, all this can be addressed with the treatment I just explained to you.